should be the topic of my talk because I do fat grafting, I do nano fat grafting, I have done my PhD in stem cells, and there are few regulations. So I thought it should be like my own journey. So when I was going through to prepare my lecture and I was going through the literature, so I found an article which described my journey in fact. And that article is Fat Grafting, Regenerative Surgery, a current review. This is published in December 2022 in the top-notch journal of plastic surgery, plastic and reconstructive surgery. So I was talking to Dr. Ghazala yesterday about this article. So this article has not used any stem cells. They have not used SVF, they have not used, in different studies they have referred to, they have only used fat grafting. That stresses upon the point that fat probably alone could serve as a regenerative tool, though the effects would not be as much as of purified fat, as of SPF, as of expanded stem cells. Okay? So, my storyboard would be background of adipose tissue-derived stem cells, then problems, then revival, technique modification, stem cell-assisted lipotransfer, our experience, stem cell application in aesthetic surgery, and exosomes. I would be only talking about exosomes, maybe 1 or 2 slides as a clinician. Professor Fridoon would give a detailed review about exosomes. So, somebody mentioned about use of stem cells in different joint diseases. So this is not new. So improvement of joint mobility after surgery for ankylosis has been used in 1914, and what they did, they simply used fat. They didn't know that fat contains stem cells, but probably at that time stem cell would have worked. So problem with fat grafting was that most of it would absorb. So this was first noted by London pair in 1956 that most of the fat which we transfer or which we inject is absorbed. So there were multiple reasons for it, and according to him, increased trauma and mechanical damage was the main reason. So fat was sparingly available. If we inject the fat, it would get absorbed. So what is the fun? So it went down. The popularity of fat grafting went down. Unfortunately, what happened was that there came the suction-assisted lipectomy. People wanted to get rid of their fat. There was a lot of fat available. So they thought that if we inject, we will over-inject, some would be resolved. But abundant supply again popularized the fat. Not for fat grafting, but as a spare part that something has to be wasted, so why not inject it? So then it gained popularity again. Okay, so that was the uphill task course. Now, first attempt for the fat grafting to be successful was attempted by Mr. Coleman, who first described lipostructure, and he first said that we have to think about the preparation, about the processing and injection technique as an independent variables for the take of the fat graft. So processing and placement was described by him. Now this is the basics which we all follow now. And this starts with, even if you are going to prepare SVF, if you are going to prepare nano fat, if you are going to separate stem cells, if you are going to expand the stem cells, you have to follow all these steps. 3 steps. So what are those steps? We will be doing hands-on tomorrow for those who are novice in this field. Harvesting, then purification. Purification again has different methods, but studies have proven that no method is superior to the other, though a recent literature review by Coleman has again stressed upon the importance of centrifuge. But in my personal experience, I am not using centrifuge anymore. I am using simple gravity sedimentation, and it works well. So purification is again important, and last but not the least is placement. Again, it is very important. So these are the three basic steps. And if we make an analogy between a farmer sowing seed for the harvest of a crop, so we can draw some similarities between the two techniques. So this comprises of a 4S component. What is that 4S component? First is soil, recipient side. So where your Professor Mahmood Sabah was talking about how to increase the success of stem cells. So probably recipient side is most important if you want to inject fat, SPF, nano fat or stem cells expanded. So recipient side, that would be soil. You know, soil is most important for the successful yield of a crop. Seed, fat graft itself, how fat graft has been harvested, from where it has been harvested, how it has been prepared. Then sowing, again, once you have harvested the seed is available with you, now you have to sow it, how you sow it. That would also determine the outcome. And last but not the least, post-graft care. After you have put in stem cells, after you have put in SVF, nanofat, whatever you are using, so you have to provide a support, that is post-graft care. Now, this is very important. As a plastic surgeon, we deal with various reconstructive patients who present to us, and there is an indication of fat grafting. So the area where you are going to inject the fat is very important. So capacity, recipient site capacity, how much is the recipient site can retain, or how much is the capacity of the recipient site, I would explain it further. Volume. Now one is the capacity and one is the volume. I said that there was a lot of fat available after suction assisted lipectomy, and people started thinking that we should over-inject, some of it would be absorbed but rest would stay there. This concept is not right. If you keep this concept of capacity and volume, okay, you will see how it is important. Now second is compliance. Capacity, compliance and volume you are injecting. A picture would explain this better. So you can see here, this is a patient of Romberg's disease or idiopathic hemifacial atrophy, and the compliance of the tissue is poor. If you try to pinch the skin, you would see that everything is adherent to the underlying bone or skeleton. Similarly, if you have seen an irradiated skin is very hard, tough. The compliance is very poor. And obviously the capacity would also be poor. But on the other hand, if you see this patient, you can see that compliance and capacity both are good. So this is the difference. So here if you try to over-inject, what should happen? We will see. And even if here you would try to over-inject, but this would not tolerate over-injection, this may tolerate, but in my opinion it will also not tolerate. Why? Let's see. This graph is important. This is augmentation. You are trying to inject fat. You are filling, you are filling, you are filling, you are filling, you are filling. And this is survival. So up till here, survival is okay. You keep on filling, survival is okay. But the moment you start overfilling it or maximal capacity, you try to fill more than the capacity of the tissue, survival falls down. Okay? So you see, up till here, the survival would be good. So this is the space where you are filling. But the moment you move more than this, or you inject more than this, what would happen? The fat cells would not survive. Why this happens? And now this brings us the importance of SVF or stem cells. Okay? The more the stem cells would be, the better would be survival. Why? We will see. Now next would be preparation. I have already talked about preparation. Next would be the harvest. The first is from where to harvest. Studies have proven beyond doubt that you can harvest from medial thigh, lateral thigh, from abdomen. So there is no difference in the outcome, though very few studies have shown that medial thigh is probably a better site. But in my practice, it depends on patient. from where the patient wants fat to be harvested. Okay, so the recipient side doesn't matter. So, sorry, the harvest side doesn't matter. So you can harvest from anywhere. Again, there is a controversy whether there should be blood in the fat which you have harvested or not. In fact, it doesn't matter. But it looks, the fat without blood with only tumescent fluid looks nice to you, to everyone. But in fact, you can always prepare it. Preparation would take more time when there is blood in the fat. Preparation would take less time when there is a clear fat. But it doesn't matter, it doesn't affect the outcome. The important thing is that you have to harvest it with multiple hole, 12 hole cannula at least, and a relatively smaller caliber, preferably 2.5, 7 to 3 mm with 12 holes. Tomorrow we will demonstrate this. Minimally handle and prepare with gravity and filtration. This method I am using, you can use centrifuge, you can use this gravity segmentation, or you can use Tefla roll. There are various techniques available. At the end of the day, it doesn't matter. There was a lot of debate about PRP. So those who are using PRP, they would know that it doesn't matter, really, at the end of the day. So we will be doing this tomorrow, inshallah, fat harvest. So this is interesting that we have to inject this fat. So three-way stopper has been connected. We are harvesting fat from lateral thigh. So this is the container which the fat will be filled in that container so that we can use it, this sterile fat. There are other ways available. You can use ready-back suction bottle. You can you can use that, or there are special containers available where you can collect the fat and you can discard the fluid and you can use that sterilized fat for you. This is the gravity segmentation when we have to inject in breast, large volume, we use this. These kind of blood bags or anything sterile, or when you have to inject in face or smaller areas have to be injected, you can use simply these syringes to have gravity segmentation. So now you can see if this contains blood, this doesn't contain blood. So at the end of the day, it doesn't make much difference. Now, again, this is important, how to inject. Always use smaller size syringes, preferably 1 cc syringe, particularly for those who are beginning this procedure, because it has a precise control. If accidentally you push the plunger and everything goes in, still it is 1 cc. So you can easily massage it, or you can easily distribute it evenly. But as you gain experience, you can use 10 cc syringes or 5 cc syringes maybe. So no injection without motion. So whenever you are injecting, you should be continuously moving. You're slowly pushing the plunger and continuously moving, so that on a specific place, only a small fraction of fat is there, so that it can survive.